Good morning. I'm here representing Vaccine Choice Canada. We advocate for informed consent and voluntary vaccination decisions. We represent thousands of families across Canada. My name is Gisele Baribeau. I'm one of 7 directors of Vaccine Choice Canada. We all vaccinated our children. But I am the only one who does not have a vaccine-injured child, and 2 of my colleagues lost their children as a result of their vaccine injuries. There's much to discuss in your recommendations, but I will just address the issue of mandating vaccines or the removal of exemptions. On this issue, the science is a mile high, a mile wide, and a mile deep, and it's hardly settled. I have 4 quick points. Mandates are not necessary. There's no health emergency here. We've had 111 measles cases reported to date in this country of 37 million people. Pun intended that it's measly. No one died. Measles is generally a benign, short-term viral infection, and 99.99% of measles cases fully recover. The real healthcare crisis, you just heard it in your first agenda item. Focus your time and your money on that. Second point, mandates won't work. Artificial herd immunity is a failed theory. Explaining this is much more complicated than one can communicate in sound bites or in mere minutes. Read the science. Third point, the vaccine schedule has not been proven safe. And pay attention here because some of you may not know this. Vaccines are classified as biologics and are exempt from the strict and extensive safety testing required of all other drugs. The result is that no childhood vaccine product licensed for use in Canada has been safety tested using the same standards required of other medical products. The medical industry uses the monitoring of adverse events following vaccination as a primary method to evaluate safety. Our passive injury reporting system for collecting data is utterly inadequate. The U.S. system is somewhat better, and their own commission study concluded fewer than 1% of adverse events are reported. Jennifer left. I will quote her. If you can't measure it, you can't manage it. Point number 4, mandates are a violation of fundamental human rights. We don't need exemptions because mandates themselves are unconstitutional. If we don't have the most basic of rights, those of self-autonomy and bodily integrity, and the right to protect our children from known harm, what meaningful rights do we have? Few of you are even looking me in the eye. In summary, my challenge to you is threefold. Think long and hard about bringing on government-enforced medical mandates, medical treatments, because this will come back on you personally, on your children, and on your grandchildren. Second, if you want to truly reduce vaccine hesitancy, talk to us. We have produced a 16-point brochure on what will and what won't work. It's right up there, and I will leave copies for you. Third point, be careful what you wish for. Mandates can actually fuel more vaccine hesitancy. Witness what you see here. There is a reason that this is the fastest growing movement internationally. Thank you for your time.